Good afternoon. The next remedy is Apocynum Cannabinum. Yes, this is the drug. Common name is Indian hemp. Family is Apocynaceae. Old method, it belongs to third, and new method, it has a drug strength of 1/10. The part used is whole plant with the root. Okay. So few family members that you have to remember in Apocynacea. Not everything is from keynotes. You have a lot from boric side. You have Alstonia. You have another variant of Apocynum. You have Asperosperma, which is pardon the spelling, but then Asperosperma, which is pretty much familiar to all. Holorina antidysenterica, Oleander, Ravolfia, another remedy. Okay, so you have one thing I think you can relate of Apocynacea is C. Apocynum, C. Asperosperma, C. your Oleander, Ravolfia, Strophanthus. All these are somewhere having a cardiac affinity. So Apocynacea is a remedy. That family has this affinity for heart and its adjacent organs, even to an extent pulmonary organs also. Okay, so yes, going ahead, physical generals, you have excretions diminished, especially urine and sweat. Now when urine is diminished, we know there is something wrong. Can be due to your renal side, or it can be due to a shock. Dropsy of serous membrane. Okay, dropsy of serous membrane. So we have already discussed EPIS in the previous class, and now again we are coming to another dropsical remedy, that is Apocynum. We have already discussed the trio: acetic acid, EPIS, and Apocynum, where EPIS is thirstless and acetic acid, Apocynum being thirsty remedy during dropsy. Dropsy with thirst like that, just now I said acetic acid, water disagrees. But see, dropsy with thirst, but now you are going to see water disagrees or is vomited, just like that of arsenic album. Most cases uncomplicated with organic diseases. It can be after typhus, typhoid, scarlatina, cirrhosis, after abuse of quinine. Okay, so these can be the causes of dropsy in Apocynum. To say about urine diminished, I just want you to remember oliguria is less than 400 ml per day and anuria is less than 100 ml per day. Per day 24 hours. Please see the child's head. This is nothing but hydrocephalus, or in another way you can say it's a macrocephaly also, but it's more correct to say hydrocephalus. Acute hydrocephalus with open sutures, stupor, sight of one eye lost. Okay, so I think you have kind of a hemiopia or anopia, whatever it is. You have constant and voluntary motion of one arm and one leg. If you have left arm and leg, it is brania. If you have one arm and one leg, is Apocynum. The forehead is projected. So what I want you to remember is hydrocephalus, that you can see in Apocynum. Along with hydrocephalus, you have a vision loss of one eye, okay, and you have a constant voluntary motion of one arm and one leg. Okay, the sign you are going to see here is sunset sign that you can see in hydrocephalus. In female, you have amenorrhea in young girls with bloating and dropsical extension of abdomen and extremities. Okay, so you have amenorrhea, you have missed periods, okay, with dropsical affections. Can be of abdomen or extremities. Metrorrhagia, that is your intermenstrual bleeding, continued or paroxysmal flow, fluid or clotted. So it can be very fluidy type of bleeding, or can expect clots in the bleeding. Okay, you along with metrorrhagia, you have nausea, vomiting, palpitation, pulse quick, feeble when moved, vital depression and fainting. Okay, so you have a lot of features accompanying metrorrhagia, where you have a mixed type of bleeding. You can expect a fluidy type, or mean to say a very free flow of blood, or it can have a clotted kind of bleeding also, along with nausea, vomiting. You have palpitations. You kind of have fainting. It's kind of a syncope, or like symptoms of shock itself. And going ahead is your respiratory side, having cough, which again have a mixed picture. It can be short, dry cough, or it can be a loose, deep cough. Okay, so I want you to remember that the short or deep part, I want you to remember it can be a dry or a loose cough. But see what is the reason. See the reason, that is during pregnancy. So cough during pregnancy is something very important that you have to remember. And one such symptom is seen across so many remedies, namely 5 in keynotes. You have Apocynum, Causticum, Conium, Cannabinum, and Nasmosheta. Okay, so please go back to these remedies and find the exact description of it. But then yes, cough during pregnancy, you are having all these 5 remedies in your mind. Okay. Speaking of the aggravation, you have cold weather, cold drinks, and worse during uncovering. So you have cold weather, cold drinks, and uncovering. So somewhat it is showing a chilly nature. In relations, you have similar to acetic acid, epis, because it's dry dropsy. You also have relations to Ars, China, digitalis in dropsical affections. Blata orientalis have cured bad cases of general dropsy after epis, apocynum, and digitalis have failed, said by Haynes, and which again becomes another important remedy. Very important question from an AAPGT point of view. Okay, so Blata orientalis has cured bad cases of general dropsy after epis, apocynum, and digitalis have failed. Now, when you rewind to the epis part, where you have seen epis have cured scarlatina, albuminuria after cantharis, digitalis, and helleborus failed, which was given in the previous slide, and here you have Blata coming up here. Alright, so these are very recently it's been more focused. The relation part of the remedies of keynotes is pretty much focused in the APGT question paper, so that's why I'm saying again and again. So please remember, Blata orientalis have cured bad case of general dropsy after epis, apocynum, and digitalis have failed. Question for you is dropsy post-scarlatinal, Brice disease with suppression of urine, dropsy of internal and external parts with fainting when there is organic affections of heart. Okay, so we know there is a post-streptococcal glomerulonephritis, PSGN. Okay, so that is there happening in this remedy. You also have lesions of heart. Okay, so you have to think of something that covers both, and the most proper answer will be digitalis itself, because it's straight away put from digitalis of Arab's keynote. Okay. Then going ahead is your cough during pregnancy is a symptom of all except conium, sepia, calibrome, and causticum. So we know the 5 remedies, that is apocynum, causticum, conium, calibrome, and nasmosheta. The odd one out here is sepia along for the cough during pregnancy. If it's nausea during pregnancy, it's definitely sepia, but not cough. Okay, so that's the end of apocynum. Yes, sepia is the answer. Thank you.